chemical peels are one of the most oldest treatment modalities in the non-surgical arena. Top 10 in the non-surgical arena globally. And they've been done for thousands of years. So 2,000 years ago, we all know who it was, wasn't it? It's Cleopatra in Egypt. Now, Cleopatra used to get fermented goat's milk, and she used to lie in it and bathe in it for a reason, because it would soften the texture of the skin, give her smoothness and radiance, and help with the pigmentation. So peels are something that are very, very old school. We know a lot about them, there's a lot of evidence, but we wanted to do this book purely to really classify and really sift through the myths and misconceptions, because over the last few years, we've seen a lot of rise in energy-based devices and lasers, and these mustn't be forgotten because they are so easy to do and they give us so many benefits. Okay. So I want to focus on these products today. Take a look. We've got 6 peels, 1, 2, 3, 4, 5, and 6. And I know Beth is going to do a little bit of a discussion and a demonstration on the retinol peel. Before I go any further, can I get you a quick question for you guys? Who has been peeling for over 5 years? Okay. And who's new to peeling? Great. So a lot of you are advanced practitioners. That's fantastic. So today we're going to be demonstrating with Anna on Tanya 2 peel combinations. Okay, so we'll be doing this peel here called the brightening peel, 30% citric, really great for pigmentation, and we'll be also joining that together with a 20% glycolic peel here. So we'll show you how to layer peels for the face on a patient who actually has rosacea, so there's nothing to worry about too much, and I know Beth was talking about that, so rosacea are great indications for your chemical peels, and we'll show you how easy and simple it is. But all of these peels have 3 common ingredients. We have glycolic, and I know Lorna talked a little bit about the derivatives yesterday. So glycolic is a derivative of sugarcane. We have mandelic, which is a derivative of almonds. And of course, citric acid, you all know, is a derivative of citrus fruits. And of course, Stephanie talked about retinol peels. So I'll give you a little bit of a taster. This is very, very popular in my practice. I do love using retinoids, the family, both topically and also as chemical peels. They do fantastic treatments for us. And you can definitely combine these, go from one to the other, or even sometimes layer them. Okay, so let me give you a little bit of a debrief about these. I know you probably know exactly everything about these peels, but let's just have a quick debrief. So 20% glycolic acid is the most gentlest of the peels. The pH of this one is 1.6, so it's very, very gentle. So if you have a patient who's coming for the first time and they're a bit nervous, you want to be going for something like this, okay? Then you can go a little bit stronger, 35% glycolic, so the pH becomes stronger, it becomes 1.3, so more acidic, we're gonna go deeper. All of these are epidermal, just to recap. They are epidermal peels. Then you go to 50% glycolic, and this is ideal, and this is 1.2%. Okay, so 1.2 pH. So that is becoming a little bit stronger. You're going to go into the mid layer of the epidermis. And finally, we have 70% glycolic. That's the strongest glycolic we have. And look at the pH, nice and acidic at 0.6. So you want to work your patients up. These peels are amazing for smoothness, for texture, but also for fine lines. And Beth showed you some beautiful pictures before and after, and I'll show you some more. Okay, then we have this peel here, the clarifying peel. This is positioned as a peel for occasional hormonal outbreaks, for a little bit of acne, and this is a combination peel. So it's a superficial combination of mandelic and citric. So the total percentage is 30%, and the pH is 1.6. And finally, we have the brightening peel, and this is, of course, about pigmentation. So if I had a patient coming to me and they had a little bit of lentiginous, sun damage, or even melasma or PIH, post-inflammatory hyperpigmentation, this is a really great peel, and this is 30% citric at a pH of 1.6. So before I go any further, I tend to group my peels. Okay, so I kind of sell them in a course. Do you do that as well? Right, so the way I position it in my clinic is I say, after the winter, your skin's had a lot of environmental damage, so why don't we get it back into shape? Let's do some skin fitness, as Stephanie calls it. So we do a course of maybe 6 to 10 peels after the winter. Now, you can do it sooner than 3 to 4 weeks. In the treatment phase, I can do it maybe every 2 weeks, as long as the skin is back to normal. So I do it after the winter, a series, and then we do the same thing after the summer. They've gone on holidays, they've had a lot of sun exposure, so let's get your skin back to a good fit state. So we do a series after the summer. Those are my 2 blocks. In between, if patients allow me, we do maintenance, and that's just to get your skin back to normal, healthy conditions. So this is really how I position it. Before I go any further, I just want to introduce a concept to you guys. Have you heard of the words universal beauty metrics? You may have. There's a lot of research about this now in the world of beauty and psychology, etc. So we know that clarity of skin is the universal beauty metric, very similar to proportion and symmetry. So universal beauty metrics are features that we have, which no matter what your age, your gender, or your ethnic background, we all want to have. And we know we're pre-programmed for that because they correlate very closely to beauty and to youth. And this is how I talk to my patients. I say, actually, clarity is one of the most fundamental things we need to have. So peels are my foundation block. Okay, so I build my other treatments on top of the peels. So then I work with symmetry, then I work with proportion, etc., to rebuild and volumize, etc. But peels and medical skincare, they are the brother and sister. They're synergistic in my view. You have to have both together, so package them together. They are the fundamental blocks for clarity, which is your universal beauty metric. Okay, so if you want to take a picture, you can take a quick picture of how these ingredients work and the benefits we get from them. And of course, you know, glycolic acid is a very powerful, dynamic, small molecule, very, very famous in the world of peeling. And of course, it works on the epidermis. It also improves the gags in there and the skin thickness, and even a bit of epidermal pigmentation. Then of course you have citric acid. Look at the number of benefits it has. Of course it's an antioxidant. It does a little bit of pigment improvement also. And mandelic acid, a derivative of almonds or nuts. And of course, yes, you have your gags, you have your pigment evening, and importantly, it works for your oil control and your antibacterial effects. So quite a variety of benefits. Okay, and these are the kind of before and after. So in my clinic, and I think, Wendy, you're absolutely right, people respond to images better than text. In today's world, we are so short-focused on, we don't have much time to read things. We want to see something and we get an impression. So if you want to put pictures like this in your clinic, and I often do, and I often, you know, in the book we wrote, for example, at the back, there's some before and afters. So when I talk to my patients, I open to a page and I say, look, you see, these are the kind of benefits we can do with our peels. And people understand that, rather than me showing bottles and explaining lots of text. People get that. So I would really recommend, if you don't have enough images, speak to Lorna or the Neostrata team, get the images in and really get that conversation going. So you can see the improvement in not only the texture, of course the texture is better, the skin is better, clarity is better, but the fine lines, which we often resort to just toxin. And people often think, oh, I just need my toxin. You don't always have to go down the toxin route. You can start with peels and then obviously combine with toxin thereafter. And this is just after 4 peels with glycolics. And then take a look at this one. This is a difficult case, right? This is not an easy patient. And of course, this is just after 4 peels, and you can see the quality improvement in the skin. People underestimate this. They think you have to go nice and strong. You have to do, perhaps even surgery in cases like this. But you can give patients like this huge amounts of improvement. So have these pictures to talk to different age groups. So if you have somebody who's coming in their 60s, show them a picture like this. Don't show them a picture of a younger patient. They will just simply not connect. Okay, so what's happening here? She's got a little bit of acne. And what are these things called? These dark areas. Post-inflammatory hyperpigmentation. So in the world of peeling, we talk about PIH, post-inflammatory hyperpigmentation, and that is associated with darker skin types. We know that, okay? So when you have an inflammation point, or even if you scratch yourself, you will create more pigmentation. So Fitzpatrick, 3, 4, 5, 6, higher rate of PIH. That's how we really talk about it in our practice. But let me reassure you, the Neostrata peels are fantastic for darker skin types. Because people often say, oh, I'm really worried about these. Are they going to give me more PIH? No. But I always say, if you are going to do peels for the darker skin types, please do some skincare before and skincare after to prevent PIH coming through. So for the darker skin types, I always package skincare to prevent pigmentation. That's really mandatory. And look, this is only 2 peels after. Very, very quick results, okay? So let's have a look at this one. This is nice and easy. Of course, a little bit of acne. 4 peels, very simple. And even cases which are a bit more kind of, serious melasma, for example, very difficult. It's a chronic condition. We know that. And people like this need constant peeling, constant medical skincare, and constant sun protection. So with individuals like this, you can get fantastic results, and this is only after 3 peels. And look, 3 rejuvenate, so these are the 3 glycolic peels, and 2 of those glycolic peels were layered. So Anna and I are going to show you how to layer things today, because layering makes much better results, so you can target different indications at the same time. So look at this, and I know Beth was talking about rosacea, quite rightly so. Rosacea, there's a huge misconception. If you have rosacea, you shouldn't touch a patient, you should be very cautious, go on antibiotics, That's not the case. Peels are fantastic for rosacea patients, but you have to manage their expectations so they don't think they're going to get results too quickly, but we'll show you today how easy it is. Okay, so this is how I see Neostrata in my clinic. So Neostrata is a very easy to use range, very safe and very tested. The benefit with Neostrata is because you have so many protocols, right, Lorna? You know exactly what skincare to combine with what peel. And that's a huge advantage for us because it's very easy for us to say what to do with it for our patients. So look, all Fitzpatricks, all ages, all genders. And I would also say face and body. So guys, I have a question for you. Why do we talk about hair follicles? And Beth was kind of like leading up to this conversation when we talked a little bit about the chest being a high risk for scar tissue formation with our peels. So in the world of peeling, when we talk about body peeling, which I really do encourage because we have to blend our peels, otherwise we get this discrepancy between beautiful and the age giveaway. So package them together, but I'm going to tell you something. In the world of peeling, we have to be generally more cautious with the body. And why is that? Because the number of hair follicles is less. Yeah? Hair follicles is the unit where you have the healing process. So when you peel, you create a wound to a certain depth, and then you want that healing process to start and to actually give you the benefits in the long term. We know we have around 600, 700 hair follicles per centimeter squared on the face, okay? Lots and lots and lots. Fast healing. But when it comes to the body, the neck, the décolleté, the backs of the hands, we have very few hair follicles, something like 20 per centimeter squared. So the healing response is much more slower. So over the years, we've become much more conscious about what peels we select. And I have to say, Neostrata falls into that category of peels, which are very safe for body peeling. And I really would encourage combining something like face and neck, face and hands. So you know that book I showed you on hands? Did you see that? It was a green book before on hand rejuvenation. So we published that in 2014. Do you remember Madonna? There was a huge scandal about Madonna having really veiny hands, skeletal hands, and the paps were going really crazy about her hands. So we wrote that book because we thought, we have to do something for hands. Nobody's really doing anything apart from fat filling. So we devised a way of putting fillers in there, but not only fillers. You have to improve the pigmentation, exactly what you were saying, Beth. Sometimes you get those lentigines and the texture gets a little bit drier. So please, please, talk to your patients. When you take pictures like this, because it gets patients thinking about the importance of global rejuvenation. Otherwise, if you just snap the face, patients think that that's what you're coming for. So it's a little tip for you. Okay, look at all of these indications. Huge indications. And this we shouldn't underestimate, dehydrated skin, and also keratosis pilaris, and of course you can do folliculitis. So there are many exciting indications for us. Okay, happy with that? Are there any questions about pricing or how we do things in the UK or? I mean, I would agree with Wendy. Wendy, I love your idea of combination packages. So if you're doing toxin, 3 areas or 4 areas, add a peel to that. So always think about joining things together. And the way I say to my patients, I say, look, we can't just work on the muscular layer because you won't get the benefit. We work on the muscles, we work on the skin. You work on the subcutaneous fat pads or the deep fat pads, and you work on the skin. Does that make sense? So try to kind of layer the treatments. All right, so what we're going to do now, Anna's going to come and join me, and we're going to get lovely Tanya to come and sit on the bed, come and relax with us, and we will now divide the screen into 2. So you can see Tanya being peeled, and I'll show you my slides as we go along. I want to give you a step-by-step recipe, and I know most of you know how to do this, but I really want to show you how to. Oh, that's a lovely cap. Yeah, isn't it? Very elegant. whilst the AV team are sorting the lovely screens, I just want to talk a little bit about the pre-treatment discussions. So when it comes to peeling, the most important thing is to really consent our patients, and photography. Photography is really, really important because we want to make sure we document things. Patients have a habit of saying, oh, well, I can't see any changes, right? Especially with peels, which are superficial. So you have to document, have good images. I do it from the front, I do it from the sides. I get them to smile so I see the contraction of the final lines, etc. But expectations. I know you can't see Tanya's face at the moment, but perhaps, kind of, not in detail at least, but can you see she's got a little bit of redness through here, right? And Tanya's approaching, she's in her mid to late 40s now, and she said to me, I really want to work on my skin. I want to improve the smoothness, the texture, fine lines, but also tackle some of the pigmentation. Now, it's the first 30 years of our life that dictates how much pigmentation we see later on. Does that make sense? And who told us to put SPF back then? Right? We were putting oil on. So we are the generation that really need pigment control. So we can't see my screen, so I'm going to try to figure out how we're going to do the lecture at the same time. Is there any luck dividing it? No luck. Can we go screen, video on each one? Is that all right? Okay, super. Hey. So the first thing I do is we consent our patients. So very, very quickly, pregnant, breastfeeding, or planning to be, any allergies to skincare products or to peel ingredients, any autoimmune disease which affect the skin. What else do we ask? That's really, really important. What skincare products are on? Now, I really like to talk about medical skincare. When we wrote this book, we said two things. First, don't use the word chemical peel. It's a negative no-no. But do use the word medical skincare because that's a yes. That differentiates you. That gives you a USP, right? Because otherwise patients go, and exactly what Wendy said, they will go to Sephora or go somewhere else and buy some random product off the shelf. So talk about medical skincare, but move away from the word chemical. Sometimes that's a little bit scary. So find a way of brightening, brightening serum or treatment or something like that. Give yourself a little bit of a spin. So, the first thing I'm going to say to my patient is this. Skin is a large organ. It's an organ we often forget about and we misdiagnose. Or in fact, people self-diagnose most of the time. Would you agree with that? Yeah. Most people out there will self-diagnose, get whatever they think they should get because Kate Moss is on there or Brad Pitt is on there, and they will think that's the great product to do. And the problem is people don't often come and see us. So how do we get people in? I think social media is the way forward. And expectations. So I'll say skin is a large organ. It's a hugely lazy organ, so it needs maintenance. It's like going to the gym. You constantly have to give it some work. So I'm going to say, Tanya, are you all right with having a series of peels perhaps now? And really maintain that for the rest of your life. And I really want to have that expectation. Patients cannot assume I'm going to do one peel and that is it. They're going to get the most amazing results. So that's the first thing. Okay, next slide, please. So the next bit, let's have a look. Sorry, guys. Here we are. Yeah, all right. The next thing is choosing the product. Now, you may be familiar with other brands, but I want you to be aware of one thing. Take a look at this picture. Can you see, is the lighting too bright? Can you see the color here? And what color is this? Red. And what color is this circle? Normal, right? This is 20% glycolic. This is 50%. So many people make a mistake. They see a bottle and they say, oh, 50, that must be stronger. That's not always the case. So I give you one little tip. When you buy a peel, always ask about the pH at least, okay? Because you have to understand, if you have a low percentage but a very acidic pH, 1.6, versus 50% and a pH of 7, okay, less acidic, you can see this is actually a much stronger peel. So that's the first thing we have to understand. What peel do we choose? What's the pH and how is it going to work? Okay. The next thing is really, really important, particularly when you go with deeper peels in the dermis. So when we wrote the book, we talk about painting the wall. It sounds really funny, but actually, when you want to peel, you're wounding the skin. You're creating a wound to a certain depth, correct? And you want to make sure all of that surface area has the right level of penetration. So we make sure we cover all of it. We blend into the hair. Peels do not damage hair follicles. I blend into the ears because ears are age giveaways and we always seem to avoid them, don't we? We just skip these areas. And also blend or feather into the neck, so with a lighter application. What do you use? You can use a brush, single-use application. Some people use gauze for some peels, and some people use cotton tip applicators, okay? But brushes are ideal for these peels here today. And of course, look at this. This is some of Neostrata's skincare products. There are many, many more. So whenever we do a peel, I say you're going to have to take product 1, 2, 3 home with you and use it for maintenance and for better rejuvenation results post-treatment. Now, neutralizations. Quick question. Do all peels need neutralization? No, they don't. But these peels do. So there's a word called endpoints that we talk about in the book. An endpoint is an indicator of how deep you've penetrated. Yeah? So can I show you this? Can we move on to the camera really quickly? Guys, can you see this? This is the classification that we've created in 2014. This is the new classification of chemical peels, A, B, C, D, and E. How deep you wound the skin. So the old school way of discussing peels was superficial, medium, and deep. This is the new classification, A, B, C, D, and E, because you have many more endpoints. So when you're A and B, which is what we're going to be doing today, so stratum corneum and the epidermis, your endpoint will be erythema, redness of the skin. When you start penetrating into the C, D, papillary dermis, or even E, which is your upper reticular dermis, the endpoint changes. You start to see frosting. Frosting is the coagulation of the proteins, okay? So it's like cooking an egg, it goes white, and you cannot rub it off. So what we don't want to see today is we don't want to see frosting, we want to see simple erythema. With these peels, you also time them. So the other endpoint is time. It may be 1 minute, 2 minutes, 3 minutes, until you get that level of erythema, and I always monitor levels of tingling or discomfort. That's really important because when you're doing these superficial peels A and B here, you want to reach about a 6 or 7 out of 10. I don't like to push it further unless the patient says they're okay, because it discourages from future treatments. So redness, erythema, timing, and of course your levels of discomfort. Those are your endpoints for grade A and grade B epidermal peels, which is what Neostrata is. Okay, so can we go on to the next slide, please? We'll start with the cleansing whilst I do the next bit. So what we're going to do now is we're going to get this product, and it's a back-bar product. So this is your facial cleanser, and Anna's going to get the patient ready for us. And what you're going to do very, very simply is just pump and you lather it up. So the reason we're cleansing, and I think when we talk about epidermal peels, of course you're trying to remove the makeup, you're trying to remove any pollution, and of course you're trying to remove any sebum on the skin. Do I think there's any point to disinfect with alcohol or degrease with acetone for epidermal peels? Perhaps not so much, but we want to make sure that the skin is ready and primed for the application of the peel. So having done that, the next step would be this. This is your balancing pre-peel cleanser. So again, you're putting this as a second step after the cleanser. And the most important thing is this. A lot of people buy any old gauze. But actually, if you have very rough gauze, it can be very, very disruptive to the skin. So get the really soft gauze. It makes it much more comfortable for the patient. And don't rub too much, because if you do, it's effectively, you're removing some of the stratum corneum. So the peel will penetrate deeper, and you're going to get uneven levels of penetration. So let's have a look at the patient at the moment. So Anna, you're using the balancing pre-peel cleanser at the moment, and you're just giving a good old cleanse all the way through, particularly focusing on this T-zone area where we have a lot of pores. So that's the most important thing to do. Okie dokie. Can we now go on to the slides? Thank you. So the next step is very, very simple. We're going to get a Vaseline or a nice thick ointment cream, and what we're going to do is we're going to protect the lateral canthus, medial canthus, around the nostrils and the lips. If you have any little scratch marks or a little bit of trauma, you can put a bit of Vaseline on there as well. But the most important thing at this stage is I look at the skin and I check for any skin diseases. This is really important, particularly for cancers. And I think we do have a certain role. If we see something suspicious, we certainly don't want to be doing too many peels until that's been fully diagnosed. Okie dokie. So Anna, do you want to show us how to do that very quickly? We'll move on to the camera.
Sure. So I just want to reiterate Uliana's comments there, because I think vigilance in certain areas of the skin, particularly the face, for suspicious lesions, if I can put my teeth in, is very important. Other things that we just need to be cautious of in the facial region are piercings. And also in my practice, I do make a note at the consultation of just asking patients if they're contact lens wearers. Because when we come to actually neutralise this formulation, which Uliana is going to come to shortly, you'll appreciate why a lot of patients would prefer to actually have their contact lenses out for comfort. So just other pointers that we might be thinking about at the cleansing stage. So as you can see here, I've come around the alar base of the nose. She has a very small focal area pigmentation there that's been checked by a specialist before, so we're not concerned about that, just on the lateral dorsal side of her nose, if you can see. So we're not concerned about that. If we were, we would simply Vaseline and avoid the area with solution, okay? So we'll come to the other side of the alar base of her nose.
I think the reason we're doing a lot of Vaseline is simply to avoid pooling. Yeah. So when a peel pools, and they tend to actually, in my experience, pool around here, just in front of the ear crease. So these are areas we want to avoid too much pooling. But certainly with Vaseline, sometimes you put it on, sometimes I've got to be honest, in my own experience, I don't always have to do so much protection, but you can do it if you feel you wanted to. Okay, let's go on to the next slide, please. Thank you. So having done that, we then choose our peel. Today we have two peels for you. We're going to start off with a brightening peel, which is your citric acid. We're going to layer it on with a brush, leave it on for hopefully 2 minutes, as long as the patient's tolerating it and as long as we still have the erythema. We then get our 20% glycolic, this one here, pH of 1.6, and we're going to put it on top right away. Layer, again, a second layer on top, and the idea is we want improvement in pigmentation and improvement in the texture of the skin. So let's go back into our patient. Let's have a look. There we go. Okay, Anna, let's start with the application. So chin up, that's great.
Okay, so you're probably noticing that actually at this point before application, I don't have the patient's eyes covered with eye pads. The reason for that in terms of the UK protocol is that with the application being a fan brush, which you can hopefully see here, and you'll see in much more detail when I come to apply this to the skin, there is a potential risk that if the eye area is covered during the application process, that we may have a sort of a limited view of how the skin's responding under the eye that's covered, okay? So during the peel application process, we're going to keep the brush moving, a nice even application. We're going to observe the skin very, very closely, and of course we'll ask our patient to keep her eyes closed. Okay. So we start at the forehead typically. Whether you move counterclockwise or anti-clockwise, it's personal choice. But ideally, what you're aiming to try to do, first thing is to keep the solution well away from the patient's face, but you're aiming to try and get that first coat of solution onto the skin within a minute. If the application of the first layer is a little on the slow side, the danger is that you don't get a sort of a fair representation of how the skin's responding within a reasonable time frame. So you need to work sort of fairly methodically, make sure each area is covered evenly. You don't need to over-treat each area. You simply need to ensure that each area of the skin has a nice even application, whether you're using the glycolic or whether you're using the citric acid. So here, as Uliana says, we're using the citric acid formulation as our first solution.
And the most important thing is obviously covering every space, particularly when you do repeat peels, you need to make sure you're giving a full coverage. So try to kind of do a strip and then do another strip right next to it. So doing a random strip like this will actually give you a little bit of skip lesions, which are not so important on epidermal peels, but certainly very important when you do deeper dermal peels. So guys, I go right into the hairline. I see far too many peels finishing too early and you get this demarcation over time. So blend it right into the hairline. I do the earlobes also, and blend and feather into the neck with a lighter application. So then what you do is you just observe. So you say, Tanya, out of 10, what would you say is the tingling on here? So I tap the forehead and I say around the forehead. Out of 10.
Oh, 0.
0. Okay, on the right cheek here?
0.
0. And on the left cheek?
0.
And on the chin?
0 still.
Fantastic. So we're timing. At the moment, it's just been over 1 minute and 20 seconds. Okay, so what we're doing is we're using the rest of the solution. That's probably about 3 to 5 ml of product. So we want to keep on applying it throughout.
What we can see, though, and hopefully it's clear to you on the audience, is that if we just look at the chin area quite focally here, it's seeming as though we're getting sort of some focal erythema there. And this is the interesting thing with these formulations, because even though sometimes your patients may say to you, I don't actually feel anything on a scale of 0 to 10, actually the skin may be telling you a very different story. And this is why it's so important that you watch the skin so closely. The beauty, thank you, the beauty of this peel system means that if we need to, we can just do a focal neutralisation in that area if we need to, okay? Just to take
Anna,
down...
so far you've just put the brightening peel and you've just neutralised around the chin. Okay.
Yeah, absolutely.
So what we're going to do now is we're going to move to the glycolic 20% at a pH of 1.6. And so again, Anna's going to be applying it right on top. So we're now about 2.5 minutes in. So we hope to get another minute of the glycolic on top if the patient tolerates it. And to me, the skin looks really, really lovely. So if we just stay there with the camera, that's absolutely fantastic. That looks really normal. I want to see more erythema. Beth, right? Stephanie, we want to see much more erythema. So I will be very, very comfortable to keep on going. Maybe maximum 5 minutes, 6, 7 minutes, as long as the patient can tolerate it. Tanya, how is the sensation going?
Still fine, still 0.
0. My goodness, maybe 1. Okay. You're very generous today. Okay, all right. So you can see this is the second application. Excellent. That's really, really great. So the people often ask the question, if you get solution into the eye, what do you do? That's a very, very common question. So obviously, can you see the way Anna handles the pot? We go around the patient's face. We never go over the patient's face when we apply it. And we never have a brush which is loaded and dripping. That's one of the most important basic things for us to do. Certainly, if you have any contact with eyes, you want to rinse it. You get aqueous solutions for the eyes, you just rinse that. If you are using other peels, you may have to have oil, mineral oil for phenol. So if you are doing things like that, just make sure you get your mineral oils for your phenol peels. And you just douse and send them off to the ophthalmologist ASAP. We don't want any corneal damage. So the most important thing is, of course, blending into the neck. So we do a gentle application all the way down like this, rather than just doing a one-off stroke. So that's great. Okie dokie. So can we now have a look at our neutralizer? I'm just conscious of time.
Okay.
It's now 4 minutes in.
Okay.
All right. So what we might need to do, although she's not feeling a 6 or a 7, which we were hoping she would feel, you may want to wait a little bit longer, but we have to speed up because I know it's lunchtime and I'm sure you're a little bit hypoglycemic at the moment. So we're going to go on to our neutralizer. Can we just have a look at the neutralizer? That's okay. So that's part of the range. Is the foaming peel neutralizer, and this is your sodium bicarbonate. So it comes with a little nozzle like this, very easy to use. Now, what you can do is you can actually just spray it directly on the skin or spray it in a container, load your gauze with it, and then just wipe through. So it really depends on your personal preferences.
Sure. For me, at least, my personal preference on that note, obviously we start to neutralise at the order to which we applied the solution, okay? I just want to talk you through what you're seeing here. So this is a sodium bicarbonate-based neutraliser. The whitening that you're seeing here is an exothermic response. It's an intense release, if you like, of carbon dioxide. And the advantage I find in my practice is by letting the solution run, even though it may just initially look a little bit wet for a minute or two, it does at least give you a clear clinical idea of when your solution is neutralised, okay? But as Uliana says, obviously there's some personal preference in that in terms of how clinicians choose to neutralise. But the most important thing is that the skin is absolutely neutralised. We have to be respectful of the pH of the formulations that we're dealing with here, and particularly because we've done a layering with 2 low pH formulations. Both these formulations we've used, as Uliana has said, have a pH of 1.6, okay?
So you must pre-warn your patients. When you're doing neutralization, I always say, it's going to get nice and hot now. Okay, and that's a really good sensation for you, so you must experience that. So just pre-warn them, otherwise they think, oh, something's going wrong, why am I getting all this sensation all of a sudden? Okie dokie. So again, like we said, it always tends to pull around the ear, exactly around through here. So that's the area we tend to put a little bit more neutralizer just to ensure we've neutralized the full peel.
And as Uliana said, also with obviously patients having a hairband or some sort of hairnet in place, the danger is that the solution can obviously naturally pull back into the hairline. So it's a good idea to obviously try and pull the hairband or the hairnet back as far as possible, so you are actually neutralising into the hairline and also into the sort of little groove into the ear there. Anywhere where there is kind of soft tissue laxity, even a strong mental crease at the chin, you need to be extremely careful, pull the skin apart, make sure the solution is very clearly neutralised. So we can still see we still have some slightly active areas here. So we keep neutralising until we're categorically sure that everything that we're seeing that's running from the face is clear, okay?
Super. So once you've done that, and we have no more bubbling, what you're going to do is you're going to put, so you like to put some gauze with some cold water on just to make the patient feel a bit more comfortable. So can I go to my slides, please, if that's all right? So whilst Anna puts the cold gauze with water, I just want to give you a little bit of a debrief on the post-peel care. People often think, oh, you've just done the peel, you've neutralised, off you go home. That's not the case. The skin is ready for infusion, and that's what I say, let's infuse the skin. And Beth was talking a lot about infusing the skin post-lasers, perhaps, post even microneedling, etc. So this is how we infuse the skin. You have some back bar products, which I would recommend you buy. There are 1, 2, 3, 4, 5, 6, and you might think that's a lot of products, but actually you will only use 3 of those, and we'll decide all together which ones we want to use for Tanya today. Just out of interest, have you all tried these products? Yes? Some of us haven't, that's all right. So let's go and have a look. These are the active ingredients: gluconolactone, lactobionic acid, your polyhydroxy acids, of course. You've got your neoglucosamine, and Stephanie was talking about the benefits of this treatment. Aminophyll, which is today's big ingredient, and of course your Metrixyl 3000 peptides and your gardenia extract. So take a picture of this, because this will give you the exact reasons as to why you want each of these ingredients. So the trick is not to just have one product with one ingredient, but to have synergy. You want to have a little bit of this, a little bit of this, a little bit of this. You want to mix and match, because you can see they improve not only exfoliation of the epidermis, but they work on the deeper structures, on the dermal structures, pro-collagen effects, gag increase, etc. And of course, many of them work on reducing erythema. So these are really important things for us to be aware of also. Okay? All right, so I want you to tell me which one you think Tanya will need. So the first product is called the Targeted Benefits Serum. You have a choice of 2. Tanya has got a little bit of rosacea type 1, a little bit of sensitive skin. Would you choose Aminophyll complex or the Firming Collagen Booster? Well, if you have lines and wrinkles, which is what we were trying to work with today, because we applied the glycolic to really try to improve the texture of the skin, we decided with Anna she might benefit from some Aminophyll complex. Okay, this is very easy to apply. It's a serum. You pump and you massage all over the face, and give it a bit of take some time, because people love to be pampered, and we talked about this earlier. You can even put a little bit of the LEDs after and then put these products on top, but give yourself a little bit of time, really give a massage. So can we have a look at the camera, please? Let's move on to the camera. Is that all right? So here we go. So this is the product being applied. You can go quite close to the eyes. I have no problem with that. And blend into the ears and to the neck. Give your patients a little bit of a pampering treatment. Tanya, how are you feeling? No tingling? Feeling good? All right. So let's go on to our next treatment. So let's go back onto the slides. So the next product is one of these, restorative bionic treatments. So you have a choice of the Bionic Face Cream or the Bionic Face Serum. The cream is ideal for sensitive, rosacea, dry skin types. It's got both of your gluconolactone and lactobionic PHAs. And of course, if you have normal skin types, you go for the serum, okay? It's a slightly stronger percentage. So today we decided we're gonna go with the cream. So you use an almond size volume. And again, you apply it all over around the eyes. I keep a distance of ½ a centimeter from the lower edge, from the lateral canthus, and just on the bony margin, and again blend into the ears and into the back, into the front and the back of the neck. So let's go into the camera mode, if that's all right. And here we go.
So you can probably appreciate, in comparison to the Aminophyll serum that we just used, that actually the Bionic cream, I'll just put some on my hand for those of you that are not familiar with how it looks in consistency, does have a thicker consistency and a more moisturising and nourishing with the gluconolactone and the lactobionic acid. But nonetheless, as I say, for skins that need that moisture, that barrier protection, that deep hydration in the dermal matrix, especially post-treatment, this is fantastic. A little bit with these products goes a long way, and I tend to find, as a general rule with the Neostrata range, the products that you're using that have a pump dispenser to them, you will find, even post-treatment, that one pump is enough. They are designed to be layered, particularly post-treatment. One pump is plenty, okay?
Super, thank you, Anna. All right, let's go to the final slide. So this is now your block, your sunblocks. We mustn't let our patients walk out of the clinic without one of these. So you have a choice of two again. So you have your daytime protection cream, which is a factor 23 broad spectrum UVA and B, physical and chemical. This is ideal for your sensitive rosacea prone skin, so obviously we're going to be using that today. It has an addition of gluconolactone and lactobionic acid. So not only are you protecting, but you're also getting the skin stimulated at the same time. However, if you have oily, acne-prone skin, you want to go for this one, sheer hydration, okay? Again, it has neoglucosamine, so this is a great product for you. And this is an SPF of 35, and this is a chemical block. So let's have a quick look then. Should we apply that onto the skin? Let's show you the texture and the color of that. It blends in beautifully.
So daytime protection cream we have here. Added antioxidant protection, as Uliana says, with the Chardonnay grapeseed extract, which has an exceptionally high ORAC score, which we were discussing yesterday. This is a fantastic choice as a product, also as a retail product. For patients with rosacea, atopic skins, very sensitive, dry skins, where we're really trying to restore the barrier function, thicken that epidermal layer, and nourish the skin. It's fantastic post-treatment, and as Uliana says, broad spectrum UVA and UVB protection as well.
Guys, I have a question for you. So how much volume should we be putting of the SPF? So according to the studies, we always have this discussion, don't we? So according to the studies, they say it's about 2 ml per centimetre squared. I mean, that's crazy, isn't it? We would walk like a cake.
Yeah.
So this is what I say to my patients. After the peel, I put the product on and they take it home. And I say 2 finger lengths worth, 2 finger lengths. Every morning, regardless of what they're doing, you're going to put it from here down to here and blend, 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 quite close to the eyes, okay? That's something I say to my patients, and I think that's the only way to get the message across, because people often think that SPFs are not so mandatory, but it is such an important part of our protocols today. Okay, Anna, I think we're doing really well. Tanya, how are you feeling? No tingling, nothing at all? Good sensation? Fabulous. Okay, let's go on to the slides if that's all right. So, Beth spoke a lot about the combination treatments, and I would totally agree with you, Beth. I think toxins would be absolutely fine to do right after the peel. And typically for someone like Tanya, she has a bit of toxin in the glabella area, so this is something I would definitely encourage us to do. And certainly perhaps even around the crow's feet, there's a lot of studies showing that when you combine toxin, it really stretches the skin. So the peel results are much more improved. So toxin and peels for me have a lot of synergy, and I really would recommend you do that. I do a lot of toxin, for example, in the platysma, in the mentalis, in the masseter. So really try to blend your toxins full face and down to the neck. With regard to fillers, I would err on the side of caution, just like Beth mentioned. I do think with fillers, it gets a bit more invasive. So you may want to alter them, do a peel, wait 2 weeks and do your fillers thereafter, because we tend to do fillers pan-facially these days, unless of course you're doing very focal area. Are there any other questions on these combination treatments from you guys? No? Okie dokie, let's move on then. So before and afters, you've seen these, you get fantastic results when you combine toxin, fillers with your peels. It's of course much more beneficial for our patients. Okay, so very, very quickly, I'm just gonna give you a little bit of a taster before we go into lunch. The retinol peel. Beth is going to talk about this, but Lorna asked me to give you a little bit of an introduction about this. These are the kind of results, so please stay with us after lunch. You get fantastic improvement in the fine lines, in overall pigmentation, clarity of skin, and of course, it's not just that. You can improve pigmentation and also treat your acne-prone skin, your hormonal outbreaks, even after 2 peels like these. Very quick results. So the key ingredient will be 3% retinol, and Beth will talk much, much more about this. She'll do a demonstration for you also, so you get a good idea of how to use it. But it's a relatively new peel in the Neostrata range, but it's fantastic for us. Okay, we're all done. I want to say thank you to Anna. Thank you for Tanya. Thank you for being such a wonderful model. You've been absolutely fantastic. And thank you.